we should go ahead and start. So thank you, Kyle, for agreeing to give a talk in the bird seminar. So as just as a general notification for everyone, this talk will be recorded, and the slides as well as the link to the talk will be made available for the participants who had registered in advance. So today we have Dr. Kyle Kopko, the Executive Director of the Center for Rural Pennsylvania. As usual, I assume that the talk will be very interesting because the last two times you guys had the talk, it was very, very interactive. So without further delay, I'll take it away.
All right. Thank you so much for having me here this afternoon. And I'm also representing my colleague, Lisa Davis, who had a last minute conflict. And so she was not able to join us here this afternoon, but I certainly wanted to acknowledge her contribution here to these slides and the presentation. I'm also joined here this afternoon by my colleague, Jonathan Johnson from the Center for Rural Pennsylvania, who's our senior policy analyst. And Jonathan is in charge of our database at the Center for Rural Pennsylvania. So much of the data that you will see here this afternoon is a product of his work and the work of also our colleague, David Martin. So we'll just dig right into this here. For those of you who may not be familiar with the Center for Rural Pennsylvania, I wanted to give a very brief background because many of the folks online here today are affiliated with Penn State, and you're one of the institutions that is eligible for our research grants. So backing up, we are a legislative agency of the Pennsylvania General Assembly. We were formed in 1987 at a time whenever rural Pennsylvania was going through a lot of different economic and transformative changes in terms of its demographics. The General Assembly essentially didn't have a lot of good information about what was happening in rural communities. And so we were established essentially as a think tank to benefit the General Assembly, to provide them information. We do so in two different ways. One is through our grants program, where we are just ready to launch our next round of RFPs, where researchers can conduct applied policy research on a wide range of topics, including healthcare, to help inform the actions of the General Assembly. And as I mentioned, also, Jonathan oversees our database, and we are able to combine information from our partners at the federal government, state agencies, even private foundations, and research that we conduct in-house to provide trends, analysis of what is happening, not just in our rural communities, but also do a comparative analysis to see how this is similar or different from our urban communities as well. Aside from those, we also have the ability to host legislative hearings. 2 weeks ago, we held our 19th hearing since 2014 on the substance use disorder crisis and opioid crisis in rural Pennsylvania. So you can check out all that information on our website. And if you're ever interested in any of our data, any of our grants programs, please feel free to be in touch with us, because ultimately we want to fund these opportunities. We want to work with faculty members to ensure that they have the opportunity to produce great policy research, and that benefits all of Pennsylvania. So just to give you a sense of some of the things that we've worked on in the past, distance learning, social determinants of health after COVID, municipal land use, effects of COVID and education policy. What we have coming up in the near future, later this year, we are going to have population projections out through 2050 for every single county in Pennsylvania. We'll get into that here in just a little bit. Also, how do we reverse some of the population declines that we're witnessing? And we also have a few forthcoming projects. So for the higher ed folks, alternative tuition strategies and models, that's going to be coming out here in the near future. All right, and I will advance the slide here. It looks like my clicker. There we go. I wanted to first start off by providing some background on rural Pennsylvania. And for those of you who may have attended one of our presentations in the past, this will look familiar, but I think it's a great way of setting a baseline of understanding the environment in which we're discussing policy issues, and particularly healthcare. First, you need to know something about the people, broadly speaking, and I think that helps to set the stage for the context of healthcare. And we're going to specifically discuss the economic impact and the power that healthcare has within Pennsylvania's economy. So that's really going to be the crux of what we discuss today. So what is rural Pennsylvania? As you can see here on this map, we have a definition of what constitutes rural. And this is one of the definitions. We have a county, school district, and municipal level definition. And for those of you who may have worked on federal grants in the past involving rural issues, you know that the federal government has all different types of definitions depending on which agency you're working with. Ours is pretty straightforward. It's a binary measure. It's either rural or urban, and it's based upon population density. So if you're below the average population density, we classify that county or school district, and for the most part, municipalities, as rural. If you're at or above that threshold, it's urban. And you can see here, based upon this map, the vast majority of Pennsylvania is considered rural. So about 75% of the landmass is rural by our definition. And it's roughly 3.4 million people. And so one of my favorite factoids to always discuss is if you were to take rural Pennsylvania and make it its own state, it would have a population greater than 21 states in the District of Columbia. So we're talking about a pretty sizable amount of economic activity, people. It's essentially Utah. That's the closest state in size to rural Pennsylvania. And these slides are freely available. If anyone would like a copy, feel free to send me an email. I'd be happy to forward them on to you. I wanted to first start off by showing how population shifts have occurred over time in both our rural communities and our urban communities. And we'll dig into this a little bit more in showing where this has actually occurred. So we have two different trends here. So the purple line here is population over time in our urban counties, our urban communities, while the green bars here represent rural Pennsylvania. So what you can see here is that there's been a steady increase over time in the population for our urban communities, but rural has largely been stagnant. We lost nearly 100,000 people in rural Pennsylvania between the 2010 and the 2020 census. So where's the growth happening right now in Pennsylvania? And we've highlighted what we refer to as the Southeast. It's not just Philadelphia and the collar counties. This is really the I-81, I-78 transportation corridors. So anything that's in this orangish salmony color witnessed population increases between 2010 and 2020. For the most part, rural Pennsylvania lost population. Now, it's not exclusively the case. Obviously, we had some growth in Pike, Snyder, Center, Butler, counties as well. But for the most part, it's been a decline during this period of time. And this is something that's been ongoing for a number of years. This isn't anything particularly new. I think that this graph here helps to contextualize some of the demographic trends that we're seeing, particularly with regard to age, and that will tie into healthcare in just a little bit. This is just for rural communities. This is not Pennsylvania overall or urban areas. It's just rural Pennsylvania. The red line here is the percentage of population in our rural communities that's under 20 years of age, whereas the purple line represents senior citizens. So based upon our last estimates, based upon 2010 census data, we will soon have more senior citizens in rural Pennsylvania than what we do young people. And this is actually going to be a trend that persists with us for some years to come. And it's not strictly rural phenomenon. So you can see here estimates from 2011, 2020, 2030, 2040. Any of the shaded counties here in Pennsylvania represent those communities that have more senior citizens than young people. So it was only 3 counties as of 2011, increases to 18 counties by 2020. But by the end of this decade, we're projecting 47 out of our 67 counties having more senior citizens than young people. And that largely persists then through 2040. Again, we'll have better estimates here later this year The Census Bureau is supposed to release their age cohort data in May. I really, really hope that they stay true to their word because it's already been greatly delayed. I'm sure everyone realizes the census had a number of setbacks due to the pandemic, but that'll really help us to engage in some better long-term planning. But I don't doubt that the new projections are going to look fundamentally different than what we're showing here, and it will probably persist out through 2050. And then just in terms of household income and spending power, I think that this helps to show that, there is a gap between rural and urban. And this is true in many contexts here. And this even accounts for inflation over time. And you can see even as of our latest data, there's about a $15,000 gap between households in urban areas, per capita income in urban areas versus our rural communities. I'll show one more slide here about rural people, and then we'll get into some more specific information about healthcare in the rural economy. So this isn't meant to be anything causal in nature. It's simply a matter that, there are individuals that have more distinct health issues in rural communities versus urban communities. And we already showed that there are more elderly individuals living in rural communities. So this shouldn't be a big shock in light of that. Again, it's not necessarily that rural is causal. It's just that there's other factors underlying the breakdown between rural and urban. But I think that this helps to give a better sense of what's happening in each of the communities. So things like number of car accidents per 100,000 people, there's slightly more in rural versus urban. Incidence of cancer per 100,000, 37.9 in rural, 26.0 in urban. Deaths are slightly more cardiovascular disease, heart disease, cancer. Interestingly enough, drug overdoses, though, are more in urban areas once you standardize based on population. But Alzheimer's disease, diabetes, suicide rates, liver disease, and influenza all tend to be a little bit higher in our rural communities versus urban communities. Again, not causal, but there are other underlying issues for that population that helps to explain that. Okay, I'll pause there for a second. I know I'm throwing a lot of information at folks. And if you do have questions along the way, I should be able to see that in the chat box here too. So if you do have something that you want to get off your chest sooner rather than later and ask a question about a slide, feel free to do so. And if I don't see your question and you want to grab my attention, feel free to unmute and say, hey, Kyle, I have a quick question. So I'll pause right now. Are there any initial questions about rural Pennsylvania and some of the demographic trends that we just showed? All right, then. Well, I'll progress. Okay, I think I see it. One here on our chat here. Let's see. If you have any information on tobacco use and tobacco retailers, yes, we do have information on tobacco use. I'm going to go out on a limb and say that it is more in rural as well, but we could certainly put that together. We do have that information, and we could break that down. If you wouldn't mind, if you could please send me an email, kopko@rural.pa.gov, and we can package that for you and send you some slides to that effect. And I should note too that a lot of the information that we have here, we can package it in a variety of different ways. We might be able to, depending on how granular the data is, provide county-specific information if anyone has a particular interest in a given region of the state or community. So please do feel free to reach out about that. That's absolutely fine. Okay. So moving on, let's talk about the economy in rural areas here. Let me. Oh, and yes, we do have information on lifestyle behaviors. If you have any particular information, I don't know if we have things like how many people exercise per day or something like that. But if you have particular questions, this is from Katie. Please let me know. We can see if we can dig that up for you.
So Kyle, I have to give a heads up to you for some weird reason. I can't see the chat. Unfortunately, you'll have to keep an eye on it.
Okay, all right, no problem at all. All right, so let's talk about rural healthcare and its economic implications here. A lot going on here, but here's the key takeaway. And again, we can share this slide here. These are all the different employment sectors within rural Pennsylvania. Healthcare and social services, they make up the bulk of it, 17%. The next closest one is manufacturing at 14% and retail trade at 12%. So I should note here that social assistance also includes a number of different like social workers, those related professions too. But I think that these are all interrelated professions that help to show how large of a segment of the workforce and the economy healthcare tends to be in rural Pennsylvania. Over time, you can also see how employment in the healthcare sector and social services sector has fluctuated over time. So it hit a peak in 2019. And then obviously with the onset of the pandemic in 2020, it started to decrease. And actually right now in 2022, this is not unusual, particularly in regard to other types of employment sectors. Folks left the workforce for a variety of reasons, and it is now at a 10-year low based upon all the data that we have available. So we're still tracking for 2023, but right now there's just over 200,000 individuals in the healthcare sector in rural Pennsylvania. The next lowest data point was 2013, whenever it was 201,000 at the time. So pretty close, but still it's a historic low, at least for the last 10 years. And I think what this map helps to show is just how much healthcare contributes to average wages, particularly within rural areas. And we see a rural-urban divide here. So if you look at all industries in rural Pennsylvania, here are your average wages per month, a little over $4,100. But in the healthcare and social services sector, it's slightly more, $4,300 or so. Although they pay slightly less compared to all the other industries in urban areas. Anything up here that's in yellow, any of these counties, means that the average wage for healthcare is greater in that county compared to all other sectors. So if you're in healthcare in any of these yellow shaded counties, you're doing better than average compared to all the other types of workers within that county. And again, a lot of this region here is rural, so it has a significant effect on the rural economy. And to put a finer point on this, any of the shaded counties here denote counties where healthcare is the biggest employer as of the third quarter in 2022. So you can see much of Western Pennsylvania, the northern tier, in through Geisinger, Montour, and Columbia, those areas, it's a significant part of the rural economy and Pennsylvania's economy for that matter. And what's the economic impact then of healthcare? So we have a couple of different pie charts here, and these are all economic indicators based upon direct impacts and indirect impacts. And by that, I mean, whenever an employer invests money from their budget, there are going to be ripple effects to that money. If they're paying employees, if they're buying supplies, so wages, supplies, that's going to be the direct impact. But what is the effect on the suppliers and all the employees that they have to employ and the materials that they need to buy and so on and so forth? That gets at the ripple effect. So just in terms of hospital spending, for all of Pennsylvania, it's over $167 billion annually. We're talking about over 500,000 jobs and salaries in excess of $38 billion. So again, major source of economic activity. And we have two different maps here, which I think help to show where there are, one, short-term and critical access hospitals throughout Pennsylvania. That's this map up here. And then two, rural health clinics and FQHCs by county down here. So if we overlay it, it looks to be pretty busy as a map, but I think that this gets to help show by geography where there's significant institutional drivers of economic activity, either for hospitals overall or for health clinics. And you can see any county that has these cross marks on it, that means that there's no hospital located within that county. Now, they might have an FQHC or a rural health clinic. For example, there's several in Pike County, but they do not have their own standalone hospital. And we break it down here by rural and urban. There's 48 short-term care hospitals in rural, 90 in urban, 15 critical access hospitals in rural, 1 in urban. Obviously, not many rural health clinics in urban areas, and FQHCs, 176 versus 221 in urban communities. I see another chat here. Says hospitals are high cost and income, yet more healthcare is provided in community settings. Do you have economics for non-hospital health orgs? Yes, we will get to some of that here momentarily. We will get to different types of medical providers, dentists, nurse practitioners, physician assistants, things like that. And actually here we have some employment statistics. I have to see if we have the economic impact of, say, rural health clinics. I'm not sure that we do. And if we don't, I have an idea of a few agencies that might have that. So if you could please send me an email, we can dig into that a little bit more. All right. So this slide denotes healthcare facilities, the types of healthcare facilities per 100,000 residents in both rural and urban Pennsylvania. So when you break it down in that regard, actually rural has slightly more hospitals compared to urban. But again, this is all standardized based upon population, more FQHCs. There are more skilled nursing facilities when we standardize it there, but fewer retail pharmacies. There tends to be slightly more in our urban communities relative to rural Pennsylvania. Physicians' offices. Now, this is as of the second quarter of 2022, but there's slightly more in urban communities, slightly more dentist offices in urban areas, and substance abuse and facilities slightly more in urban. So it's a little bit of a mixed bag whenever we standardize it based upon population. And whenever we look at the insurance rates throughout Pennsylvania and compare that to the national average, first of all, Pennsylvania ranks pretty low in terms of the uninsured rate. The national average is 10.4%. Pennsylvania is just over 7%. So we're doing pretty well, relatively speaking, compared to the national picture. So any pink shaded, purple shaded areas have a relatively high percentage of uninsured, 15% or more. In the yellow region, that's the middle one, 10 to 14%, and anything in white is under 10%. And what we see when comparing rural and urban, so rural in green, urban here in yellow, over time, there's been a decrease, and this is obviously when Medicaid expansion began, and we're starting to see a slight increase in the percentage of individuals who are uninsured. So for urban areas, they're at 7.5% as of 2020, 8.4% in 2020 for our rural communities. So just a quick fast five here on the economic impact of healthcare systems in rural Pennsylvania. So this is data from the Brookings Institution, so one of the private entities that we rely on to help stock our database. U.S. per capita healthcare spending quadrupled from 1980 to 2018. It's almost twice as high as the average from OECD, so that's the Organization for Economic Cooperation and Development, organization of 38 industrialized countries. Most healthcare spending is on hospitals and professional services. This is an interesting one here too. 5% of Americans accounted for half of all healthcare spending in 2017. And expenditures obviously are going to be higher and variable for those with the poorest of health. So that tends to be a big driver of our healthcare costs. Now, we just set the groundwork that healthcare is such a vital and important part of our rural healthcare. Now, I want to talk about some of the things that are a little precarious for the healthcare system and rural economy going forward. And at the Center for Rural Pennsylvania, we just can't help but insert puns and try to come up with nerdy humor. So healthcare, is it the osteoporotic backbone of the rural economy? Sorry, we don't get out too much, so we find humor in these sorts of things. So let's talk about some of the strain that are facing our healthcare systems in rural areas. So workforce. And honestly, this isn't unlike a lot of other areas for employment, but still it's concerning because healthcare is so darn important and we want to make sure that we have a vibrant workforce for it. Over time, the percentage of the workforce in healthcare is becoming older. So it was, this is the band that measures, are you 55 years of age or older? Back in 2002, only 15% of the workforce was 55 years of age or older. That increased to 24% by 2012. And as of 2022, it's 28%. So what we see is this middle shrinking. In terms of overall percentages, there are fewer individuals in the 35 to 54-year-old range in the workforce. And then there's a slightly fewer percentage of under 35-year-olds. It kind of fluctuates in terms of overall percentages from 31% in 2002, 29%, and then a slight uptick in 2022. But here's where we're seeing the squeeze is on this middle category. And we have a larger share of our workforce being elderly. So not elderly, sorry, just over 55 years of age. I misspoke there. But the point being is that this is going to create, I think, some workforce pipeline issues down the road, even more so than what we're seeing here today. And a lot of that is just due to the fact that the overall population, not just of rural Pennsylvania, but Pennsylvania overall is becoming older. We have fewer high school graduates, for example. So I think we're going to have to think carefully about what that means for a variety of our industries, particularly healthcare. And what's been happening to our occupancy rates in hospitals over time. So we break this down by rural and urban. So rural in green, urban in yellow. You can see the occupancy rates over time. They ticked up during the COVID-19 pandemic, but they were on a bit of a decline, particularly in rural areas. So the occupancy rate much higher typically in urban areas, not as much in rural. And the average number of full-time hospital employees, you can see how this has fluctuated, went to a high in 19 and 20, and then it's starting to creep down again. So some troubling trends, not monumental, but it's something we need to keep an eye on going forward. So let's look at the differences in the profiles of employees who work in the healthcare system between rural and urban areas. So this column here is rural. This column here is urban. So you can see that there's obviously more employed persons in the healthcare sector in urban Pennsylvania because it's a greater share of the population. Nothing too surprising there. Similar ages, much more likely to be persons of color in urban communities. Similar percentage of female employees, slightly higher in rural, but similar overall. More likely to have foreign-born employees in urban Pennsylvania versus rural Pennsylvania. Similar percentages employed by nonprofit organizations, but slightly higher in urban communities. Similar amount of employees with children in their household. We do see a bit of a gap here with regard to bachelor degree attainment, where individuals in urban areas are more likely to have bachelor's degrees relative to those in rural communities. Commute times are relatively similar. Number of hours worked per week, similar. There is still a wage gap, but this is also true in many different industries when comparing rural and urban. So it's not unique to the healthcare sector, and a similar number of seasonally and part-time employees between urban and rural Pennsylvania. So there are some similarities, but there's also some clear differences here in what the workforce looks like and their characteristics. And here's where we get into some information about changes in the types of healthcare professionals over time. And to make matters just easier to digest, we presented this as percentage change. We do have the raw data on how these numbers have fluctuated over time, but primary care physicians, so previous slide, we showed facilities. These are actual types of employees. So these are individuals employed in the sector. So there's been a decline of about 4% over 10 years of primary care physicians in rural Pennsylvania, but an increase of 7% in our urban communities. Pediatric physicians, decline of 1% in rural, uptick of 4% in urban. OBGYNs, this is particularly concerning, 12% decline in our rural communities, but a 9% increase in urban. Psychiatrists are down across the board in both rural and urban. Obviously, mental health is a very real and big concern in many of our communities. Dentists, however, have increased in both communities. And what we see for this entire bottom line is there have been increases in both rural and urban communities with regard to these specific professionals. Physicians' assistants, up over 100% in both rural and urban over the past 10 years. Nurse practitioners, almost 200% increase in rural and urban. Nurse midwives also increasing 44% in rural, 72% versus urban. What explains this increase? Well, I think there's a variety of factors, and I think we can all speculate on why that might be the case. Less education is needed to be completed to engage in this. The costs are lower. Someone can get one of these degrees, enter the workforce pretty quickly, relatively speaking, and earn a very respectable wage too. So undoubtedly, some market forces are at play here as well. And I think too, it helps to contextualize these trends based upon Medicare and Medicaid dependent populations. So what we mean by that is the percentage of the population that is either completely or partially dependent on Medicare or Medicaid for health insurance. So any of the dark green counties here, that's above the statewide rate of 29.9%. So in our rural communities, some sort of government-funded health insurance program is providing the bulk of insurance coverage for many of these individuals. And we all know, too, that generally speaking, these reimbursement rates are also going to be lower. So I think that helps to place additional constraints on our healthcare system relative to our urban communities as well. That leads to hospitals and health systems that are financially vulnerable. You can see here percentage of vulnerable hospitals by state. Even though in previous slides I showed that Pennsylvania is doing well in terms of insurance rates, in terms of financially vulnerable hospitals, unfortunately, we are among some of the most at-risk states in the country. So we have more than 20% of our hospitals at risk. This is from Chartis Center for Rural Health. And so we fall into the category of between 20 and 25% of our hospitals being at risk. And here they are mapped out. These are all rural hospitals that are potentially vulnerable as of 2022. So again, mainly in our rural areas, you can see Wayne, Kesson Hospital, Guthrie and Towanda, UPMC, Lock Haven, obviously a big change in Lock Haven with the closing down of their primary hospital, moving towards an emergency department. I'll talk about that in just a little bit. Bucktail, UPMC Kane, Warren, Corey, UPMC Northwest, Grove City, Greenville, Jamestown, down here in Washington County. And it's it's something that we're tracking very carefully, but there's also some potential policy implications and solutions too that could help to mitigate some of these financial challenges. And we'll talk about that right now. I think we all know the dire situation of having a hospital closure within a community. It places additional strains on our EMTs and other first responders. It's a loss of economic development. It decreases morale. It just has this long ripple effect throughout the entire community. And we've actually had a few hospitals close in Pennsylvania in recent years. We've had at least 5. We've had nationally 147 rural hospitals that have closed throughout the entire United States. So unfortunately, this is a really important trend. And I think we are going to see some more of these closures. But there are some ways that we can try to stave off the worst outcomes. And I wanted to talk about a few of those innovative and emerging models of care here. For those of you who may not be familiar with the Pennsylvania Rural Health Model, I'd really encourage you to Google it. We did a hearing at the Center for Rural Pennsylvania last year on this model. And this map here shows you all the hospitals that are part of this model. So it's a partnership between the Rural Health Center and CMMI and CMS. I'm going to really oversimplify things here, but I'm sure a lot of you are familiar with budget billing for whenever you have to pay, say, your electric bill or your gas bill or some other utility bill, where it's standardized over time. So that's meant to avoid fluctuations in the market. Well, you can take a similar type of approach to reimbursements for CMMI and then also other insurance providers. They're able to look at a hospital system, look at their historic reimbursement rates, and determine what is a good best case scenario projection for the coming year or two. And they will then provide a global budget, so a set amount of funds that will come into that hospital system. So in other words, it moves away from the fee-for-service model and instead provides a steady stream of income so hospitals could instead focus on preventative measures and be more proactive and also collaborative across hospital systems in addressing public health concerns. And the strategic thought is that if there is this guaranteed stream of revenue, then that means a focus on preventative medicine and trying to address some of these concerns in public health sooner rather than later will avoid some of those dramatic costs at the end. So remember my previous slide where 5% of the population is driving about 50% of the cost. So if we can focus on some of those individuals and address their healthcare needs sooner rather than later, that's going to lead to decreased costs overall. So it's basically making an upfront investment in public health. So I'd really encourage you to take a look at this. Pennsylvania is the first state to have this type of model. It's still relatively young and new, but there are a number of hospital CEOs that have flat out said that without this program in place, they would not have been able to make it through the COVID-19 pandemic. So it may be a policy solution for some individuals. So I encourage you to check that out. In addition, our Department of Health and also our partners at the federal level are testing a number of different models. And here are a few that are just starting to spring up in Pennsylvania. Some of these have been around now for several years, but I just wanted to go over them now because I think it's going to be interesting to track the outcomes of these types of facilities and what it means for healthcare in the very end. So micro hospitals. So these are acute care hospitals that offer emergency services, and they have at least 10 inpatient beds. These were the former innovative hospital models, and the Bradford Regional McKean County Hospital is an example of that. Outpatient emergency departments, or OEDs. So this is an outpatient location of a hospital that offers only emergency services. And that's essentially what UPMC Lock Haven in Clinton County is transitioning to. So some of you are probably familiar with the decision to close down the full-blown hospital at Lock Haven, but at least this outpatient emergency department will still be functional. There's also the option for a tele-emergency department, or tele-ed. Basically, it's staffed by an advanced practice provider, an APP. It could be someone like a nurse practitioner, physician assistant, so on and so forth. But there's always going to be a physician on call through electronic means. So that way they can at least supervise electronically or through a medium such as this to provide some counseling and potentially help to stabilize patients, and they could be transported elsewhere if need be. An example of this is UPMC Kane in McKean County. And something that's very, very new is the rural emergency hospital designation. And Pennsylvania does not have one of these quite yet, but this provides also some baseline of funding for hospitals on a monthly basis. So here's the criteria. It's for rural acute care hospitals with 50 or fewer beds that were opened on December 27th, 2020, or they could have been closed after that same date. Now, if you accept this designation, there will be an outpatient prospective payment system rate plus an additional 5% added on for all outpatient department services provided for Medicare. Okay. And then on top of that, they're guaranteed to receive just shy of $275,000 per month for this year. And that will be tied to increases in subsequent years. Now, that does not guarantee profitability for that hospital, but it at least provides some baseline of guaranteed income and a little bit higher reimbursement rate as well. So the point being is we're not just sitting back realizing that there are problems and challenges in the healthcare system. There are some new models that are forming, and folks are being proactive in this regard. And I think that's a good thing, but now comes the time where we need to assess what this means going forward. And is one approach more or less effective in one community versus another? And it's very, very early to be able to tell what this means going forward. All right, so quick 5 takeaways. So healthcare obviously is very important within rural Pennsylvania. We show that it's a sizable portion of our economy. Healthcare indicators in terms of personal health, but also many of the types of providers are lagging in rural communities relative to our urban counterparts. And we know that there are some structural weaknesses, particularly within the workforce. But we do have these innovative models in place. And I think it's also important to note that what's happening in rural Pennsylvania, it isn't unique to just rural Pennsylvania. These are really national trends that affect rural communities. So a lot of these same data trends you would probably find in rural parts of Ohio, Western New York, Western Maryland, West Virginia, Northwest Virginia, pretty much throughout the Appalachian region. So this isn't something where a particular policy or a particular administration or anything of the sort is really driving this in rural Pennsylvania. These are largely based on macro trends that are bigger than any one community, but we do need to be very cognizant of these trends nonetheless. All right, and with that, I'll pause and I'd be happy to answer any questions that you may have. Thank you very much.
Thanks, Kyle. And I think at this point, like if you have questions, just unmute yourself and speaking up will be helpful.
And in the meantime, I'm going to put my email address into the chat box here.
Hello, Kyle, this is Moso.
Moso,
Thank you
how
so
are you?
much. Hi, I'm doing well. Thank you so much for the great talk. A
Well,
lot
thank
of great information. So I would like to, can you show us the website for the grant information?
Yes, happy to do so. Let me pull this up here on my second screen. All right, can everyone see, whoops, sorry here, let me cancel out of that. Can everyone see our website here? Is that coming through? Yes? No?
Yes, yes.
Yes, okay. So if you go over to research grants, and you can click right on that. Whoops, actually just under request for proposals. Request for proposals right here. Now you'll see it says 2023 request for proposals. That's last year's topic. Within next week, we will have an updated RFP, which will have a variety of topics. And I just wanted to briefly touch upon that. We provide grants up to $50,000 for faculty and researchers at any of the Penn State campuses. It's not just University Park. Any of the PASHE schools, or any of the regional campuses of the University of Pittsburgh. Now, other faculty members, even out-of-state faculty members, could be a co-PI, but the lead researcher must be from either a Penn State campus, a Pitt regional campus, or a PASHE campus. And we are going to have a few health-related topics, particularly on hospital sustainability in this new RFP, which will soon be released. On top of that, we also have what we call an open topics category. So we always list out a bunch of topics that we're interested in receiving proposals on because members of the General Assembly asked us to look into a particular topic. But we also welcome proposals that aren't related to those specific targeted topics. So if you think that there's a important policy issue that might be flying below the radar, or if you think that there's a study that we previously funded but is in need of updating, and we have a number of those studies, great things that were done maybe 15, 20 years ago, but obviously a lot has changed by then. Feel free to also make a submission under open topics addressing one of those. And we do provide feedback on drafts of letters of intent. And if you're invited to submit a full application, we also provide feedback on those as well. And we're just happy to chat about any potential policy topics that you might think are worth researching. And even if you decide not to apply for a grant with us, if you're just interested in talking about research in general and maybe how state government can be of assistance, we're more than happy to try to connect you with partnering agencies, either at the state level or federal level. So regardless, please feel free to think of us as a resource.
Thank you so much.
Mm-hmm. And I will also note that we do have some data on our website as well. You can see our definitions here, but we also have recently launched Tableau dashboards. If anyone needs quick access to information on counties, school districts, or municipalities, we have a variety of dashboards already here online: demographics, housing, and workforce for those three categories. So feel free to check that out if it's of use.
Kyle, when it comes to the labor market, I mean, you touched a little bit about people leaving the labor market, right? So, but do you have any data, or have you seen any trends, anything interesting in terms of layoffs?
In terms of layoffs in the hospital sector, I'm not sure if we have that. John, are you still on by chance? He might have logged off.
No, he's logged. No, he's there. No.
Nope, that's fine. Aside from hospitals closing, yes, we have that information on how many employees were impacted as a result of layoffs. We also have general unemployment information. But I don't know if we have information on, say, if a health clinic closed or something along those lines, something at a micro level. We definitely have it for hospitals and for major employers, but I'm just not sure if we have it at the smaller level.
All right, thank you. Any other questions for Kyle? Well, thank you very much, Kyle. And I'm just giving you a heads up that you forgot to share the email address just in case if you.
Oh, I did a direct message to Sophia. I'm so sorry. Here, let me do that to everyone. That's why. I'm sorry. There we go. Did that go to everyone?
Yeah.
Now?
Yes.
I didn't realize it was a direct message. I'm so sorry about that. Thank you very much. But you can also Google us, Center for Rural Pennsylvania, and feel free to be in touch with any of us.
All right. Thank you very much. I appreciate it.
All right. Have a great afternoon, everyone. Hope your week's off to a terrific start.
Right. Thank you. Bye-bye.
Bye-bye.
Thank you. Thank you, Kyle.